All right, welcome to another deep dive. This time, we're going to tackle something, you hear about a lot growing up, but might not think about too much as an adult. Growth hormone,
Exactly.
GH.
Yeah.
We all know that it helps kids grow taller. But
Mhm.
what we're going to look at today is that it really is like a powerful regulator for your body your whole life.
Yeah, affecting things from muscle building and metabolism, even to how we age.
It's like having this hidden control panel,
Right?
and we're going to like unlock the secrets.
Absolutely.
So we've got some medical excerpts here that break down the science of GH. What are normal levels, and then also what happens when things go wrong.
Yeah, and I think it's fascinating. A lot of people think GH is just for kids,
Right.
but it's really working all the time, even as adults, driving cell repair and keeping our metabolism running smoothly.
So let's get into that then. What does that look like in our bodies when it's doing all that?
Well, think of GH as like a, a construction crew that's constantly working on your body's infrastructure.
Right.
They're building new cells, fixing damaged ones, and making sure everything runs efficiently. And that's why it's so crucial for our energy levels, how much muscle we have, even how well our bodies use the nutrients we get from food. And that's throughout our entire lifespan.
So it's like our own personal maintenance team. It's
Exactly.
just keeping things running.
Now, before we look at what happens when things go wrong, let's talk about what normal GH levels actually look like.
Okay.
The sources here give us a range for what's considered normal, but it's important to remember that everybody's levels can vary quite a bit.
Well, I'm already curious about like what causes those variations, but let's hear those ranges first.
Sure, so for children, the basal levels, and that just means the amount of GH in your blood when you're resting, you haven't eaten recently, are typically between 0 and 10 nanograms per milliliter.
Okay.
After a stimulation test, which we'll talk about later, those levels should jump to above 10.
Got it. And what about adults?
For adults, the basal GH levels usually fall between 0 and 5 nanograms per milliliter. And after a stimulation test, we want to see those levels rise above 5. But remember, these are just averages.
Okay, so there's a range.
Yeah.
And now I'm even more curious, like why those individual variations?
Right.
What are some of the things that cause that?
Well, first off, age and sex play a role.
Uh-huh.
GH production naturally declines as we get older,
Right.
and men tend to have slightly higher levels than women.
Okay. Makes sense. What else?
Well, our bodies also have a natural rhythm for GH release called the circadian rhythm.
Okay.
So this means that GH levels actually fluctuate throughout the day.
Is that like a workout boost where I feel more energized at a certain time?
You're close. It actually peaks during deep sleep,
Oh,
especially in those first few hours.
interesting.
And that's one reason why good sleep is so crucial, because it's prime time for GH to work its repair and recovery magic.
So like a construction crew working overnight when there's less traffic.
Precisely. And there are other factors too. Exercise can give GH a temporary boost,
Okay.
signaling your body to build and repair muscle tissue, and even what you've recently eaten can have an effect.
Mm.
Fasting or being in a calorie deficit can actually increase GH,
Interesting.
while obesity is often associated with lower levels.
Okay, so we've got age, sex, sleep, exercise,
Mhm.
even food impacting these GH levels. It's amazing how many things are connected. Like this is like a control panel for so many body functions.
It is.
But before we jump into what those tests actually involve, I'm really curious about what happens when these GH levels fall outside of the normal range.
Yeah, that's where things can get complicated.
Okay.
Having too much or too little GH can lead to some significant health issues.
All right, so let's unpack that then.
Sure.
What happens when things go wrong?
Well, if GH levels get too high, it can lead to a condition called acromegaly in adults.
Okay.
And this happens when the pituitary gland, which is a tiny but powerful gland in the brain that produces GH, goes into overdrive.
So the pituitary gland is like the foreman of our GH construction crew.
Yes.
Okay, and when it goes overboard, what actually happens to our bodies?
Well, it's not just about being tall.
Okay.
The excess GH in acromegaly causes bones to thicken, tissues to grow, leading to enlarged hands and feet. Changes in facial features, even.
Oh, I hadn't thought of it that way.
Yeah.
Are there other symptoms besides those growth changes?
Yes, unfortunately, acromegaly can also lead to joint pain, headaches, and even changes in vision.
Oh, wow.
Plus, it can interfere with metabolism, increasing the risk of diabetes and heart disease.
That definitely sounds like something you wouldn't want to ignore. You
Yeah.
mentioned acromegaly in adults. What about children? Do they experience the same issues?
In children, excessively high GH levels lead to a condition called gigantism.
Okay.
As the name suggests, it causes abnormal height and growth, but it can also cause other problems like delayed puberty and muscle weakness.
Okay, so too much GH is definitely not a good thing. What about the opposite scenario?
Right.
What happens if someone has low GH levels?
That's where we see conditions like growth hormone deficiency, or GHD.
Yeah.
And it can be present from birth, which we call congenital GHD, or it can develop later in life due to injury or illness.
And what kind of consequences come with having too little GH?
Well, it really depends on when it develops.
Uh-huh.
In children, GHD primarily affects their growth. They might be much shorter than their peers and have delayed puberty, but in adults, low GH can lead to a cascade of metabolic issues.
Okay.
Think increased body fat, decreased muscle mass, low energy, even mood changes.
Wow. I'm starting to see just how crucial GH is to our overall health. But how do doctors even figure out if someone's levels are off? I'm guessing it's not as simple as just a blood test.
You're right. It's not that straightforward. Doctors use some specialized tests to assess GH function. It's not as simple as just getting a number. They need to see how the body responds to certain challenges.
Interesting. So what do those challenges look like?
There are two main types of tests: stimulation tests and suppression tests. Let's start with stimulation tests. These are used when doctors suspect someone might have GHD,
Okay.
meaning their pituitary gland isn't producing enough GH.
Okay, so with a stimulation test, they're trying to get the pituitary gland to produce more GH.
Exactly. They give the patient something that should trigger a surge in GH release and then monitor the response.
That makes sense.
Huh.
What about suppression tests? When are those used?
Suppression tests are the flip side.
Okay.
They're used when doctors think someone might have too much GH, like an acromegaly.
Got it.
They give the patient something that should normally suppress GH production and then check their levels.
So stimulation tests are like hitting the gas on GH production, and suppression tests are like tapping the brakes.
That's a great way to put it.
Okay.
It's all about seeing how well the pituitary gland can respond to different signals.
This is fascinating.
Mm.
So we left off talking about these stimulation and suppression tests. How do those actually work?
Well, let's start with a common stimulation test called the insulin tolerance test, or ITT.
ITT. Okay, and what happens during this test?
So in the ITT, the patient receives a small dose of insulin, which temporarily lowers their blood sugar.
Okay.
Now, this might sound a little concerning,
Right.
but it's perfectly safe when done in a medical setting.
So why would they intentionally lower someone's blood sugar?
Well, when your blood sugar drops, your body naturally tries to bring it back up.
Uh-huh.
And one way it does this is by releasing GH.
Okay.
So by giving insulin, doctors can see how well the pituitary gland responds to that challenge and whether it releases enough GH to counter the low blood sugar.
That's pretty clever. Are there any other stimulation tests besides the ITT?
Yes, another one is the arginine infusion test.
Okay.
In this test, the patient receives an infusion of arginine, which is an amino acid, directly into their bloodstream.
And arginine triggers GH release.
Exactly. Arginine is known to stimulate GH production. So this test gives doctors another way to assess how well that pituitary gland is functioning.
Okay, so we've covered stimulation tests. What about those suppression tests we talked about?
Right. The most common suppression test is the oral glucose tolerance test, or OGTT.
Okay.
You might be familiar with this one because it's also used to diagnose diabetes.
Oh, right. I have heard of that one. It involves drinking a sugary drink, if I remember correctly.
You got it. In the OGTT, the patient drinks a solution containing a measured amount of glucose. Now, normally when you consume glucose, your blood sugar rises.
Right.
And that signals to the pituitary gland to decrease GH production.
So it's like a signal telling the construction crew to take a break.
Exactly.
Okay.
In someone with too much GH, their levels won't suppress as they should after that glucose load. And that can be a strong indicator of a condition like acromegaly.
So these tests really help paint a picture of what's going on with GH production in the body. But I imagine interpreting those results isn't as simple as just looking at the numbers.
You're absolutely right. It's not just about the number itself. It's crucial to consider the context. Like the person's age, sex, sleep habits, exercise routine, even what they ate that day. All those factors we talked about earlier come into play when interpreting the results.
So it sounds like having a doctor who understands all those nuances is incredibly important.
Absolutely. That's why consulting with a healthcare professional, especially an endocrinologist who specializes in hormones, is so crucial.
Okay.
They can look at the results, consider the individual's medical history, and determine if more investigation is needed.
It sounds like we've covered a lot of ground today. We've learned about GH's role in the body, what normal and abnormal levels look like, and even these intricate tests used to assess GH function.
We certainly have. It's amazing how much is happening with this one hormone.
Yeah, it really makes you realize how complex and interconnected our bodies are. Before we wrap up this deep dive into growth hormone, I'm curious to know what you think our listeners should take away from all this information. What's the one key message you want them to remember?
I think the biggest takeaway here is that growth hormone isn't just about, those childhood growth spurts. It's a vital part of our health, throughout our entire lives.
Yeah, it's easy to think of GH as something we leave behind, in our teenage years. But it's so much more than that.
Exactly. And understanding how it works, what can influence those GH levels, and the signs of potential problems, I think can really empower people to take charge of their health.
So how can our listeners apply this knowledge then?
Well, I mean, based on what we've talked about today, prioritizing good sleep is a great place to start. We know that GH levels peak during deep sleep. So, making sure you're getting enough of those crucial hours of rest, I think can really make a difference in your body's ability to repair and recover.
No more skimping on sleep.
Right.
Got it.
Yeah.
What about exercise? Does this change how we should think about working out?
It definitely reinforces the importance of regular physical activity. Exercise is a natural GH booster. It helps build muscle mass, improve metabolism. So whether it's hitting the gym, going for a run, or even just taking a brisk walk, incorporating movement into your routine is a great way to support healthy GH levels.
Okay, so we've got sleep, exercise. Anything else we should keep in mind?
Well, here's something interesting to consider. We often think of aging as this inevitable decline.
Right.
But knowing that GH plays a role in cell repair and metabolism, suggests that we might have more control over how we age than we realize.
That's a really empowering thought.
Mm.
It's not about stopping the clock, but it's about, supporting our bodies so they can age gracefully.
Exactly. And I think that's where this knowledge becomes really valuable. It's not just about understanding the science. It's about using that understanding to make, informed choices that benefit our long-term health and well-being.
Well, this has been a fascinating deep dive. I feel like I've gained a whole new level of understanding about how my body works. To our amazing listeners, thank you for joining us on this exploration of growth hormone. Remember, the deep dive is all about giving you the knowledge to better understand the world around you. So go out there, apply what you've learned, and keep those brains buzzing.
You've been listening to the Learning Podcast, a production of metaNESTA. Remember, learning is a journey. One step, one insight, one skill at a time. We'll see you next time. Keep learning, stay curious, and as always, be awesome.